The outcomes framework is designed as a framework by which the Secretary of State will hold the new NHS Commissioning Board to account. And in turn, the NHS Commissioning Board will have a commissioning outcomes framework by which it holds the GP consortia to account. The GP consortia, of course, replace PCTs in this new world. It includes a number of departures from previous policies, in that primarily the Secretary of State intends to hold the board to account on the basis of health outcomes. So we no longer have targets, as we used to, for instance, around waiting times and so on, but there will be a list of specified measures called outcomes that the Secretary of State will hold the board to account. We welcome a focused look at improving outcomes of healthcare as a broad general statement. That said, we do have some comments around the contents of the document. We think that it can perhaps at places start being quite prescriptive in terms of defining quite narrow measures. And we think a framework for the board should really be much higher level and broader. Otherwise, there's a risk that those indicators then get passed down as targets. More generally, we think that there are some omissions from the framework. It does specifically focus on outcomes of NHS care, and it does make reference to the fact that public health and prevention will be addressed in a separate white paper. But on the other hand, we feel quite strongly that public health, prevention, health improvement are essential roles for both GPs and the NHS, and particularly in this new world for GPs as both providers, so in the sense of what they're doing in their own practices, but also as commissioners. So we really think that that ought to be integral to this framework and not sit separately. One of the other aspects of the document that we think it's important to comment on is that although it says that the Secretary of State will expect improvements in those outcomes, it doesn't actually define what constitutes acceptable or unacceptable levels of performance. There's a long list of indicators there. Some could get better, some could get worse, some could get better by a small margin or not. But I think given the level of investment in the NHS, people will want to know, they will want some tangible, quantifiable dimensions of how performance will be assessed, and it's really important to get that across. In relation to the outcomes framework, we think that instead of developing a new conceptual framework, there's been a lot of work done internationally on assessing the performance of health systems, and we think that using one of those frameworks that are evidence-based and have quite a lot of international acceptability might be a preferable option instead of trying to create a new framework which, as we've already pointed out, does omit some dimensions of what we think is high-quality health systems performance. So that would be one recommendation. The other recommendation is, while we accept the need to look at outcomes, at the same time there is a very large evidence base to suggest that a lot of quality measures are in fact process measures. So it's really important to understand and assess and measure and improve the processes of delivering high quality care, because outcomes can be determined by long-term effects. They may be affected by factors outside of the healthcare system, but it's really important to determine that the clinical processes of care are high quality as well. Another aspect of performance that we think is really important is for patients to have timely access to care. And at the moment, access and waiting doesn't appear in the framework at all. And with the NHS facing more difficult times economically, it's possible that waiting times could rise, and we think that this does need to be monitored. As well as, especially for patients with long-term conditions, we think it's really important to measure integrated care across patient pathways.